Knee grinding and clicking can sound pretty horrible and concerning, and research actually shows that it can be significant in some cases. So in this video I discuss the implications of knee noises, who should be worried, who shouldn't be worried, and what you can do about it. Knee grating and crackling, or crepitus as it's known, is thought to come from fluid movement within the knee, tendons sliding past bony surfaces, or joint cavitations like when you crack your knuckles. But most knee noises are just that, noises, and most people don't need to be concerned. In fact, research in 1987 indicated that 99% of the population get knee noises. And smaller studies have only shown mild conflicting evidence about whether knee crepitus indicates reduced knee function. But a large, long study in 2017 showed that crepitus can be an early warning sign for osteoarthritis in people over 45 years of age, especially if they heard knee noises frequently. So if you're over 45 years old and you hear noises coming from your knee all the time, you may be at a slight risk of developing a bit of osteoarthritis in your knee over the next few years. But for everyone else, knee noises shouldn't be concerning you, unless you have associated pain, inflammation, or recent trauma. But let's say these noises are driving you batty, or you're a bit self-conscious about it. What can you do? Well, a lot of these knee noises come from underneath the kneecap, so it makes sense to reduce the pressure underneath the kneecap by loosening the quadriceps. And making sure that the kneecap is running smoothly along its track, not rubbing against the outer edge of its groove. So let's have a look at how to do those two things. If your rectus femoris muscle in your quads is tight, your kneecap will be pushed harder against the femur. So here's a good way to test it and stretch it. Lying face down on a firm surface, pull your heel towards your backside. If it touches your backside easily, you're all good. If it can't reach that far, your rectus femoris is too tight. To stretch it, pull your foot up until you can feel a slight stretch at the front of your thigh, and then tighten your abs to posteriorly tilt your pelvis. If that just sounds confusing, just push your pelvis into the floor. You should feel the stretch increase in the front of your thigh. Hold the stretch, keeping your abs tight for 20 to 30 seconds, and then do the other side, and repeat that twice each side daily until you can put your heel on your backside comfortably. If the outer quads, or the ITB, are too tight, it pulls your kneecap to the outside too much. When these muscles are tight, they often feel tender to press in this area. To test them, sit on a low chair with your knee straight and thigh muscles relaxed, and rub the area with the heel of your hand. If it's sharply painful, rub the bottom half of the outer thigh for 30 to 60 seconds once a day until it doesn't hurt to rub, and see if that helps your crepitus. A weak glute medius, or inner quad, or even flat feet can affect kneecap tracking too, so I'll leave a link to a video about that in the description box below. Well, there you go. Hope you liked the video. If you did, please consider liking and subscribing because it always really helps, and let me know how you go in the comment section below. Okay, cheers.